My name is Quinn Tucker, and I'm a research assistant at the Hope Healthy Outcomes from Positive Experiences National Resource Center, and I'm excited to share a summary of our recent publication, in their own words, Qualitative Study of Parenting During the COVID-19 Pandemic. The COVID-19 pandemic disrupted family life worldwide, and prior analysis of quantitative data showed that parental stress was significantly impacted by pandemic-related disruptions in children's lives. We wanted to understand parent experiences in their own words. This study reports the qualitative thematic analysis of the words that over 1,000 parents used to describe their experiences during the pandemic. This study used data from the Family Snapshot Survey, a nationwide cross-sectional survey of 9,000 parents that aimed to understand how COVID-19 impacted family life. The survey was distributed through an opt-in internet panel at 3 different time points within the early stages of the pandemic and included a number of items for quantitative analysis and 2 open-ended response items. This study looks at responses to the 2 open-ended questions: what, if anything, has helped you as a parent or caregiver since the pandemic, and what have your challenges been? We coded responses using an essentialist and realist methodology, which encourages the identification of themes based solely on the surface meanings of the data without interpretation. We subsequently used reflexive thematic analysis, which allows the researchers' interpretations and reflections of the data to shape conclusions. We used a deductive approach by grounding our study in the Strengthening Families approach, an evidence-based framework designed by the Center for Social Policy that identifies 5 important areas that reduce negative family health outcomes. The 5 protective factors are parental resilience, social connections, knowledge of parenting and child development, concrete supports in times of need, and social and emotional competence of children. We hypothesized that parent descriptions of what helped and challenged them would align with the protective factors, and we used these factors as our codebook's parent themes. Another parent theme, miscellaneous, was added to account for responses that were not immediately classifiable in the framework. The Strengthening Families framework is based on parents with children aged 5 and under. Therefore, we limited our analysis to responses from parents within that demographic, leaving 1,095 responses from the Family Snapshot Survey to code. Team members engaged in discussions to solidify a collective understanding of the parent themes and reach consensus through an open coding process. Once consensus coding was reached, the coding team formed groups of 2 and coded a set of 500 responses each. We found that 770 responses, or nearly 70% of the dataset, could be classified as one of the Strengthening Families protective factors. Lack of concrete support emerged as the most frequently recorded challenge. This was identified in responses describing financial and employment difficulties, missing school and child care supports, and healthcare access. The most frequent support for parents were responses under parental resilience. These were most often responses that described keeping a positive mindset and described the importance of having personal time and engaging in self-care. We found that although responses identified the Strengthening Families protective factors, responses were not easily classifiable into one category. Rather, responses identified multiple factors at once and suggested that parents and caregivers might not view them as distinct categories but as dependent on each other. These examples show how single comments from parents often overlapped with multiple protective factors. Particularly, concrete supports in times of need supported access to the other 4 protective factors. Parents highlighted that managing their parental resilience and fostering the social-emotional competence of children was helpful to them, and that it often depended on having the needed concrete supports. Conversely, their challenges predominantly indicated lacking concrete supports that would allow for maintaining parental resilience and accessing resources necessary for knowledge of parenting and child development and social-emotional competence of their children. In conclusion, parent responses align with the 5 protective factors, and further studies required to fully understand how a connected web of supportive factors influences family life. Our research underscores the key role of concrete support in allowing families to access multiple protective factors and the importance of policies that provide accessible concrete support for families. In future emergencies, targeted interventions that provide these supports are critical to family well-being. Thank you.